to Buford. We're just getting started on the left shoulder. We're looking in from the back to the front. Everything you see is magnified 30 or 40 times on the screen, as you recall. We've got our two cannulas coming in the front. Here's the biceps tendon. We look down at the anchor, and that looks reasonable. Rotator cuff just above. Looks good here. We'll take a look down the front. Most of your laxity was towards the back in the posterior direction, and as we rotate and look back here, we can see how this capsule's a bit loose, and there may be a little tear in the labrum there, which is what we saw in the imaging. We're going to go ahead and put the scope in the front in just a minute here. Possibly. Okay, Colt, so we've been using our rasp just to roughen up the capsule. And as we look back here, you can see the labrum is a little bit loose. I'm going to go ahead and put an anchor in just to make sure that we have good fixation. So that means using a spinal needle to check our angle. Looks like we can place an anchor right about there. I'm going to go ahead and make a little nick in the skin. And in just a minute, we'll place our percutaneous guide. Okay, here's our suture hook coming in. We're getting back here and going a little bit lower so we can make sure we get this posterior band of the inferior glenohumeral ligament. Now that we have that secure, we're going to bring that through and then come underneath the labrum. That relay and show you some more minute clusters. Okay, so we're going to place another stitch right here. We've got our second anchor down. You can see the first anchor. See that figure of 8 stitch. Now we're going to place another simple stitch here. More a minute. Okay, we're looking towards the back, and the work back here looks pretty good. We've got 2 anchors in, and we've really tightened up the posterior capsule. And as I said at the beginning, that was your direction of instability. I just want to make sure this anterior band of the IGL is tight, and it sure looks pretty good. Let me pull back a little bit here. So, I really don't think I can make that significantly tighter. You can see the fold right there. And I can't even see the inferior recess unless I really push. Even then I can't get in there. So I think we're going to finish up here. We sure don't want to over-tighten things. So good luck to you now. Bye-bye.